What we're going to be doing here today is providing the patient with a heat pressure cured resin temporary crown that has high strength, high aesthetics, and can be used in those special cases where your patients are very concerned with the aesthetics, or that you're concerned with being able to maintain occlusion. This new DC2 temporary crown form utilizes the same numbering guide that you would have in the polycarbonate crown shelf kit that you get from Direct Crown. However, the numbering system is on the insides of the DC2 crown shell form, and what you would do is find the one that fits the proper quadrant, go in, measure it, make sure that it's fitting your patient appropriately, check to see what the with maximum intercuspation, what the fit is, and in this particular situation it appears like we're fitting down nicely. If you take a look, the interproximals look like they're matched up very well. The patented windows utilized in this that are unique to Direct Crown, you will see, will allow us to be able to get the interproximal contacts exactly where we want them to be. Now, you have to make a decision at this point. We know that it fits, we know that it's been trimmed up appropriately, and you have to decide whether you're going to be placing this temporary restoration in with acrylic or with bisacryl. In the acrylic lining technique, once again, you're going to verify the fit of the trimmed DC2 crown shell, making sure that you can get the teeth into maximum intercuspation. And then you will take the DC2 crown shell and line it with the acrylic. In this particular case, we're utilizing the Direct Crown acrylic. I will take a pipette, draw a little bit of the acrylic up, enough so that we can line the shell. I want to make sure that you know that this Direct Crown fast set acrylic is very fast setting, 2 minutes and 45 seconds from the time that you start mixing. You're going to be able to have a completely hardened acrylic inside the crown shell. So I'm incorporating the powder into the liquid, and what I'm going to do, get it stirred around, trying not to incorporate too many bubbles, but I'm going to want to get it to a point where it's getting a little bit of a gel to it, still runny. We're going to load it into the DC2 crown shell form, and then we'll go to the patient's mouth, making sure that we seat it to place. Best to get it oriented. Seat it completely to place, and have the patient close back into their maximum intercuspation. We're going to let this material start to harden. I do have some material that is on my fingers and in the dappen dish, so we can test it as to when it gets into its rubbery stage. And once it gets to that rubbery stage, what we'll do, have the patient close, make sure that they can close into the DC2 crown shell, and we'll test it in the mouth. Still a little bit rubbery, too rubbery. All right, now we have the set to allow us to remove it and insert it back in. The idea here is that we don't want to get locked into the interproximal contours of the adjacent tooth. So we'll let it harden a bit, and then we're going to remove it and put it back in, and remove it and put it back in. And once we're satisfied that we're in the right place and we can get it in and out of the mouth, I have a little excess here, sorry. There we go. I've been up and out of there enough times. All right, now I'll let it set till it gets complete polymerization and hardens to that 2 minute and 45 second time frame. Once the lining material has completely set, what we will do is remove it from the tooth, and I'll show you a bit here how nice the adaptation is of the materials into the crown shell form. We'll go back to the lab with the DC2 crown shell form at this point and trim it and adjust it till we can bring it back to the patient. The final lined and polished DC2 crown form here is then taken back to the patient and verified that we have full seating, we have our interproximal contours the way that we'd like them to be, the embrasures are filled appropriately. Once everything's verified that the bite is okay, we then cement the final restoration with a good provisional or temporary cement.